Hello, I am Dr. Arunachalam, the principal dentist at SmilesIndia Family Dentistry. We've been in practice for more than 30 years, and our main goal is to cater to the family dental practice across almost the south of Chennai. But at the moment we do have patients who are coming from different parts of the city as well as from the country, and also some of our old patients who have moved abroad, we see them too. At Smiles India, we offer a wide range of clinical services. I am principally involved in dental implantology and oral surgery, as well as periodontology. We do have a multidisciplinary approach to treating our patients. We have two prosthodontists. We have a person trained in endodontics. We have a diploma in endodontics specialist. We do have an orthodontist. We have a pediatric dentist, and most importantly, we have an anesthetist who comes and sees us at least 3 times a week. And so our cases, we are heavily involved in sleep dentistry, which is basically sedating the patient and having a more comprehensive treatment approach. This has basically enhanced the way our practice has grown and how we have been able to establish a good rapport with the community around us. We do have a lot of referrals coming in from the doctors in the neighborhood, as well as we do have a large number of patients who are doctors themselves. So I think that can speak for itself. Our range of services, especially if you looked at implantology, we have a breadth of activity. We do have a separate 3D printing lab. So what we do is we have a CBCT machine, so we can do a cone beam computerized tomogram of the patient's jaws and be able to decide and plan the implant placement very, very precisely, so that the long-term success of implants is achieved. The treatment outcome, both functionally and appearance-wise, is much better. We have a 3D printing lab, so we make custom fabricated patient-specific guides, which are used then on the patients to be able to position the implant exactly in the right 3-dimensional space that it has to be for both an efficient final restoration as well as for the ease and comfort of the patient. So from then on, we also moved on to doing a fair number of full mouth rehabilitations, and these rehabilitations can be for patients with teeth or patients who don't have teeth. With teeth, for severe occlusal wear, we do a good number of full mouth rehabs, which are essentially enabling the patient to get back their original bite, as well as get back their function of their joints, function of their teeth, musculature, so on and so forth. We also do a completely edentulous, those who don't have teeth at all, and even for them we make full mouth rehabilitations. These are on and what we call as an all-on-X kind of a therapy, where we use sometimes between 4 and 6 implants or even 8 implants per jaw and be able to restore the entire dentition for the patient. And time is also of the essence, so we actually do this pretty fast. Most of these patients are loaded with their final dentures within the first 72 hours, and those that stay here or prefer to have a provisional denture and try this entire exercise out, for them it's usually an immediate provisional within 72 hours, and then 3 months down the line we make a more definitive final prosthesis. We also do zygomatic implants, and we also rehabilitate patients who have had major surgery and require dental and oral rehabilitation as well. The next area is because of this multidisciplinary approach, we have a good team that can take care of the restorative part. We have an interdisciplinary approach to orthodontics. We offer aligners as a good option, even as an entire treatment option as well as an intermediate treatment option. We provide hybrid orthodontic solutions where part of the treatment is with wires and braces and the other half is with aligners as well. So apart from these, our pediatric dentist specializes in handling children, most of them under local anesthesia, but we do have an intravenous, we do have a nitrous oxide sedation machine, which so some of these children, they receive nitrous oxide sedation and have have their pediatric dental work completed, and for those that require very extensive rehab, children's teeth, of course this is done under general anesthesia in a hospital nearby. So the entire plethora or range or the entire bouquet of services that Smiles India offers, right from children to adults. To the current trend today, we have a lot of elderly individuals who require full rehabilitation, and these elderly individuals usually are also medically compromised in many ways. So the age range of our patients has kind of increased in the last few years, so we are more oriented towards a geriatric type of dentistry. So we use hospital help, we also do sedation, as well as we have an anesthetist and full medical setup, which helps us to treat our patients very safely and keep any risks to the bare minimum. So we try to minimize the risks as much as possible, both in terms of medication, in terms of procedure, and follow-up is always done with our entire team. So across the spectrum of age and across the spectrum of various dental disabilities, I think Smiles India Family Dentistry has been very systematic in its approach, very organized in its approach, and we have been a very conscientious type of a practice which takes care of the patients and of the community around us.